The oropharyngeal airway flange rests against the lips. The rest of the device holds the tongue as it curves back to the pharynx. Carry a complete set to ensure the proper size, which extends from the mouth's corner to the earlobe's tip. Place the patient on their back and perform a crossed finger technique. Position the airway's tip so that it points towards the roof of the mouth. Slide the airway along the roof of the mouth past the soft tissue, uvula, or until resistance is met against the soft palate. Gently rotate the airway 180 degrees so that the tip points down to the pharynx, which prevents pushing the tongue back. On an infant or child, insert with tip pointing down toward the pharynx, using a tongue depressor to press down and forward. Ensure that the flange is against the lips. Place the mask over the in-place airway adjunct. If there is a gag reflex, remove the adjunct at once, following the anatomical curvature. Some EMS systems allow an oropharyngeal airway to be inserted with the tip pointing to the side of the mouth. The device is then rotated 90 degrees so that its tip is pointing down to the pharynx. The nasopharyngeal airway is used when there is a reduced level of responsiveness but still a gag reflex, or when the teeth are clenched and there are oral injuries. Measure the airway from the nostril to the earlobe or the angle of the jaw. Apply a water-based lubricant. Gently push the tip of the nose upward. Keep the head in a neutral position. The bevel or angled portion at the tip should point toward the base of the nostril or toward the septum. Insert airway into the nostril. Advance until the flange rests firmly against the nostril. If you experience blockage, try the other nostril. Materials that remain in the airway may be forced into the trachea or lungs, which can cause complications including pneumonia and airway obstruction. Suction when gurgling sounds are heard before, during, or after artificial ventilation. Put your finger over the proximal port. Suctioning begins from the distal end. Place the catheter where you want to begin suctioning and suction on the way out. Alternate suctioning for no more than 15 seconds with ventilating for 2 minutes. With suctioning, always use appropriate infection control practices. If gagging begins, withdraw the tip to a position where gagging stops.